Hi, it's Dr. Rod Story. I thought I would talk a little bit about cold medicines and what I would reach for if I went into the grocery store. This time of year, we tend to see a lot of colds going around as the rhinoviruses, which are adenovirus, and types of coronavirus that are not COVID-19 are just ubiquitous and they get passed around very easily. They're very contagious. What do I do when I get a head cold? Well, oftentimes I recognize first off that it's self-limited and that after 3 to 5 days, it's going to start turning a corner. Those first 3 days are often what people are reaching for medications because they're having trouble sleeping, they're so congested, they can't stop coughing. And that's where I think actually over-the-counter medicines can play a big role. So let me share with you 4 medicines that I think are worth considering and also some cautions for it. The first is a medicine called pseudoephedrine. Pseudoephedrine is a potent decongestant. You have to be careful because it can increase your blood pressure. So if you have blood pressure issues, often we exercise caution with this. I like this version because it's a 12-hour. You have to ask at the pharmacist for it. There is an over-the-counter version that doesn't require the pharmacist to sign for it, but is a medicine that if you looked at the active ingredient would say phenylephrine. That's a waste of your money. It really does no good, and it's not worth having. Second medication that I often use when I'm having trouble with cough, and the cough is more than is needed just to clear the airway, is a medicine like this. This is a combination with 2 medicines in it called dextromethorphan and guaifenesin. Dextromethorphan helps take that tickle out, and the guaifenesin helps to loosen the cough, particularly if you're drinking lots of liquids or water with it. This is again a 12-hour version, and I think those are really handy because you're not having to ride the roller coaster of the ups and downs. Nighttime, I think, is the worst, and oftentimes I'll use a medication like this, limiting myself to 3 days. This is a medicine called Afrin nasal spray. It's a very, very potent decongestant. I'm getting really close to my nose there. The medicine in it, there's several different versions, but they all work on kind of the same principle of opening up the airway, and they'll do quite a good job of it. On the opposite side, if you use them for more than 3 days, you actually start to make it worse. So they have a rebound effect, and so only use for a couple of days. The place that I would say exercise some caution is in medicines like this, combination medicines, where it's a cold and cough and flu and fever, and it covers a lot of symptoms. The problem with these is several-fold. First off, it tends to have a lot of ingredients, and those ingredients are often at doses that are much lower than are actually effective. So you have to take a lot of that. Secondly, they also tend to have Tylenol in them, and Tylenol, if you're also taking it by the handful, such as acetaminophen or in other medications, you can easily get yourself into a toxic dose, and that would obviously be not good. So careful with these. I tend to encourage people otherwise, if you want something for nighttime relief, consider taking a Benadryl or a Unisom to help yourself sleep, along with a cold and cough medicine, along with a decongestant that's potent for those first few days. And then, of course, if it keeps lingering, we're always glad to see you in the clinic. Thank you. This is Dr. Rod Story.